Thank you very much, Presiding Officer. And let me start by paying tribute to things the Labour Party have done. That's not a natural thing you would expect me to do. But I think in the last 100 years, the legislation they brought forward to establish the National Health Service is the most significant and enduring thing that we should all commend. And in this Parliament, I have in the past, and I do again today, commend Jack McConnell for his political courage in bringing forward legislation on smoking. So the Labour Party are capable of getting things right. But in this debate and the contribution made so far, I have to draw one or two different conclusions from those that we've just heard. First of all, let me just remind the Labour benches that in fact it's really the story of the National Health Service starts with the Highland and Islands Health Service, which was established in 1913 and covered half of Scotland's landmass. It was not free at the point of supply, but it set the limit as to what people paid very low, so for the first time the ordinary working man and woman had access to health service. And in rolling out in 1944, in the 1940s, as Beveridge did, he was actually drawing on that model. So the roots that have got us to where we are more diverse than perhaps just the simple idea that it was Beveridge. None the worse of any of that, I have to say, absolutely do say. And indeed, the quote from Nye Bevan in the motion is one I agree with. I'm going to do what I did in the last health debate. I went again to the carers' comments website, and they're all from the last week, because it is not all gloom and doom. This is Aberdeen Royal Infirmary. I was diagnosed with type 1 diabetes September 27. The support of the whole diabetic team at David Anderson Building, ARI, has been incredible. And then play service, and this is at Aberdeen Children's Hospital. I think the play service is a really valuable service that helps children make the hospital seem less scary. And then my son's 3.5-week stay at the Royal Aberdeen Children's Hospital. My son broke his femur at 2.5 years old and was in traction for 3.5 weeks. Now listen to this. My son really enjoyed his time with the play staff who made his stay very enjoyable. This is someone in traction with a broken femur. That's how good the hospital was. And at Dr. Gray's maternity, my grandchild was born in August 2017, had to stay in the unit for 10 days. The care that was given to both my daughter and grandchild was exceptional. Now that tells a lot about the staff in the health service. That I absolutely accept, because that's frontline experience. But it also tells us about the system that supports the staff. And I'll just conclude, Presiding Officer, with a comparison of the world before them, because, of course, I was born before the health service. I have here a copy of a medical bill that my mother had to pay, because a year before I was born, she had an ectopic pregnancy, a pregnancy in the fallopian tube. She had to go to hospital, have that fallopian tube removed, a very serious operation. And fortunately, it was done with such skill that she was then able to give birth to me, her first live birth, and 2 subsequent children. But the point is, the amount of money that's on this bill is 3.5 weeks of the average working man or woman's wage at that time. She was fortunate to come from a family that could afford that. The health service was something that made it possible for that quality of service my mother was able, fortunately, to pay for, to be available to all. And I congratulate the health service on its upcoming 70th birthday. We are all grateful for its enduring contribution to our society.